So, good morning, Dr. Schubiner.
Good morning to you.
So, today we have Dr. Howard Schubiner, an MD, who is the director of the Body-Mind Medicine program in the Ascension Providence Hospital, Southfield, Michigan, USA, and he's also a clinical professor, Michigan State University College of Human Medicine. So, thank you for your generosity and spending time to talk about the healing process, which is really, in a way, it is a mysterious. And there is nothing like a good story with a happy ending. So maybe we can start, if I may ask you about your personal experience back then, before you discovered the mind-body medicine.
Yes, I was actually interested in mind-body medicine when I was in university in my college years. I was very interested in the idea that the mind could heal the body and that there was a connection between the two, and I read a lot about that. Actually, there was some people doing work in cancer, and people were wondering, if the mind could affect cancer very much. And so I was reading about that and interested in that when I was younger. But then I went to medical school and, was a faculty at a medical school at Wayne State University in Detroit, Michigan for 18 years. And I did research and practiced in a variety of areas that were interested in people, interested in interviewing, interested in talking to people, interested in hearing people's stories. But it wasn't really mind-body medicine type work until in 2002, I had moved to my current hospital, and someone gave me a book by Dr. Sarno, John Sarno, who I'd never heard of. And I read the book and I was quite interested in it. And I called Dr. Sarno up. He's in New York, was in New York City, of course, at the time. And I asked if I could come work with him. And he said, sure. So I went to New York a few weeks later and spent a few days with him just to see what he was doing and talk with him and read more of his books. And then I came back to Detroit and I told my boss I wanted to start a mind-body clinic, and they said, sure, go ahead, that'd be fine.
Great.
And I started talking to people. And I just spent time with people, talking to people, listening to their stories of their lives and how the intersection of their lives affected whether and how they got sick or not, and whether or how they had symptoms or not, and when their symptoms got better and when their symptoms got worse, and what their childhood was like. And I began to read more and more about the brain and the subconscious brain and about emotions and about stress. And gradually over time, I learned more and more every day, and began to make this work the main focus of my career.
Yeah. And I believe you also have a personal story. Would you like to share it?
Well, I think as I started to do this work, of course, I looked at my own life and times when I had particular symptoms. The main thing that stood out was when I was an intern. I was a young doctor, fresh out of medical school, very much afraid of hurting someone or making bad decisions or making mistakes, being exposed as being an imposter or being incompetent. It so happened that I started having diarrhea every day before I went to the hospital. And I didn't really think too much of it until 6 months later, it went away. And then when it went away, I realized, oh, that was my body's reaction to the huge stress that I was feeling being a doctor. And then over the years since then, there's been many times when I had a lot of neck pain
Yeah.
in my 30s and 40s, and I would get pain, and then it would go away, or I'd wake up with a very stiff neck, and I couldn't turn my head, and I thought I had slept wrong. And doctors told me I had arthritis and pinched nerves and all sorts of things like that. And I went to physical therapy, and it would get better and it would get worse and get better over the years. And it was only when I started studying this work that I realized that, oh, that pain was due to the stress I was under as a young faculty member, as a father, as all the things that I was trying to accomplish. And because now, I don't have any neck pain, even though the MRI of my neck shows large bulging discs, shows arthritis, shows a lot of, really what many doctors would consider to be bad things, but are actually normal findings that
Yeah.
one sees on MRIs of everyone who lives.
Like he calls it normal abnormalities.
Yeah, Dr. Sarno called it normal abnormalities. And when, a few years ago, when my father was getting older, I was having a lot of leg pain, sciatic pain that's gone away. And then a couple years later, when my mom was getting sick and starting her decline, I had a lot of upper back pain, and that's gone now. And you can, if you understand that the mind and the body are connected, and you look at your life, it's not very hard for most people to make connections.
Yeah.
It's not hard at all.
So how did you heal? Just by recognizing it, just by telling yourself that it is a mind issue and not physical? How? Because
Well,
you mentioned the neck pain, the sciatica, the
the
GI
one,
issues.
the earlier ones with the neck pain in my 30s and 40s, I wasn't aware that pain was due to my brain. I just figured, I had some neck problems and I had physical therapy and it got better. I didn't connect that to stress at all. But the more recent times, a few years ago, with the leg pain and the upper back pain, those I was aware of the connection between my mind and my body. And the main thing that I did for those was wait.
Wait.
I just waited. I didn't do it. I didn't really follow my own advice, I guess I would say.
Yeah.
Maybe
Against the instinct against the reflex to do something. You just.
I didn't do anything. I just waited because I knew I was okay. I knew I would be okay. I didn't worry. I didn't go to doctors. I didn't try to solve the problem medically because I didn't think there was anything medically wrong. And I suppose it would have been smart or wise if I would have done some emotional work and dealt with some of the stress issues in my life. But I felt that it was okay. I felt I was okay. And I just waited. And then, over took a few weeks with with the leg pain. It took a few months with the upper back pain, but it went away.
So actually, if we look at your experience, did you just ignore it? Did you, when the pain was intense, what was your inner self-talk back then? What did you tell yourself?
I told myself I was going to be okay.
Uh-huh.
I told myself this would get better, that it hurts now, but there's nothing seriously wrong. This is a reaction, this is my brain, I'm okay. And I just waited. And I just kept going. I did my work, I did my job, I did my life. I focused on what was important in my life. And And then
Wow.
eventually I got better.
Did you like when I see you now talking, even the pacing of the rhythm that you talk, you seem very stoic, very poised, very composed, not overreactive or hysteric. Have you been always like this? Or
People ask me that all the time. I'm not sure the answer. I am human. I have emotions. I get upset. I get angry at times. I have always been a fairly even-keeled person. Uh, I've always been philosophical and realized that things get better, things get worse. I learned mindfulness meditation, and I practiced some meditation when I was in college in my early years. And then I learned mindfulness meditation in 1999 from John Kabat-Zinn and
yeah.
Santi Torelli. And I've been practicing and teaching that for the last 20 years now, more than 20 years. And so that's definitely helped. I think everyone should learn to do some practices to help to calm them and help them to be present in their lives and be able to better deal with and tolerate the experiences of their lives, even when it's very stressful.
So I will ask you a trivial, an obvious question, but yet I am curious about it. So the narrative about being present with our senses, keep asking ourselves what is happening now, here and now. How does this contribute? I see that it contributed to your stoic character, but how does it contribute to healing? If someone is in a chronic condition with pain, with debilitating symptoms, with loss of range of motion, how does training the brain to be present is actually working in a biological level?
Well, healing occurs. There are several components to healing, I would say. The main components of healing, I would say, overarching components are safety and compassion. And what happens in the brain when one feels safe, and what happens in the brain when one has compassion for oneself and connection to others, is that the threat alarm mechanism, the danger signals in the brain turn off, because we have a very highly advanced threat detection system. We survived on this earth for many years in large part to a threat detection system where we became very attuned to danger, physical danger and emotional danger, because human beings are social animals and we had to survive in community with other people. And so our brains are constructed so that physical danger causes a reaction. If you get cut or break a bone, you will have pain because your brain will turn on pain as an alarm mechanism. An injury doesn't cause pain. Only the brain can cause pain.
Yeah.
But it's the same with an emotional threat or an emotional danger. Because if we're in an emotional situation, an emotional danger, that threatens our existence, because we can only exist in groups. If you're kicked out of your group, if you act badly and you're being judged as being a bad person and you get kicked out of your group, you will die, because in olden times, hundreds of thousands of years ago. Do you see what I mean? And so our brains have this powerful mechanism of alerting us. And so if we're in emotional danger, like I was when I was an intern. I was in emotional danger. I wasn't in physical danger. My body, my brain reacted to that and caused a symptom, pain or diarrhea in that case. And so healing occurs by making us feel safe and connected to others and loved. And so those are the powerful mechanisms that healing occurs on. And these occur in a very biological mechanism. The genes that code for all sorts of things can be turned on and off by connection, by laughter, by compassion, by safety. And so those are the powerful mechanisms of healing that are not really appreciated, I think, very commonly by the medical profession.
Yeah, but I understand what you're saying, but if you take, for example, a person who lives in an emergency state of mind because of his childhood, because he had a disrupted childhood. So, and now they know that even very little small traumas, even not big traumas, even little things that back then the child interpreted as huge. So if he lost, if his mind was wired to live in a state of emergency, and because of this he also lost trust in people mainly, then I mean, it is a catch-22. How would he even try how can you connect to others without trust, without basic trust?
Right. Yeah, that's a very good point. There's no question that our childhood experiences, all of our life experiences, are imprinted on our brains. We have memory. We have, different explicit and implicit memory. We have subconscious memory. We have emotional memory, and all those memories can make one feel safer or less safe. Can make one feel more trusting or less trusting. That's 100% true. And of course, the people who have disruptive childhoods are much more likely to develop mind-body syndromes, are much more likely to develop physical ailments as well later in life. And that's been shown very clearly in the adverse childhood event studies and many other studies. However, we exist in our past and we exist in our present. And what we found is that you can help people heal and recover in their present and in their past. So there are lots of, and this is another area that modern medicine hasn't really understood or taken on. And a lot of psychological therapies, I would also suggest, have not taken on, because it's not just cognitive processes that are necessary to heal people. It is also emotional processes. And so there's many ways of helping people feel safe cognitively in their lives in the present, but it's often necessary to help them feel safer in their past by using emotional processes, such as memory reconsolidation type processes, to help people heal some of the hurts from their past.
What do you mean? What do you mean by memory consolidation? I don't know.
Memory reconsolidation is, the idea is that we can't change our past, obviously. But how do we know what our past is? Our past, we only know our past because of our memories of it. And memory is constantly changing. This is a scientific fact. We don't have memory like some video camera. We have memory in pockets and emotional pockets of information. And so there's ways of helping people in fantasy go back in time to visit their younger selves, or express feelings from their younger selves, or and ways of imagining changing the situation, changing the memories purposefully to help them feel more empowered, help them feel safer, help them to express feelings that they couldn't express then, help them deal with the anger that they felt, the guilt that they felt, the sadness that they felt, and help to move through those feelings to compassion for themselves, caring for themselves, letting go, and forgiveness. And when you do those things, they're healing their past, which helps them to heal their present.
Oh, this is fascinating. So actually it is visualization, a visualization technique, but you apply it on the past, not on the future. Like,
Correct.
and also, do you mean the inner child work? Did you refer to?
Yeah, that's part of it. It's the idea that we hold our whole life is held within us, and so our child is held within us, and that's healing the child that was within us, and the parts of us that are our child parts, the parts of us that are our parental parts, and so everyone has different parts of themselves, and sometimes those parts feel like they're at war, or they're fighting with us, or they're betraying us. But the idea is to move toward integrating those parts and being at peace with our past, with ourselves, and with the different parts of us that we carry with us.
I would like to stress more about what you said about the memory consolidation, the healing the past, and with your permission, I want to make it less abstract. Let's take an example, a concrete example. If a child back then had a critical caregiver, and he lived a normal childhood, no abuse, no physical, no sexual abuse, nothing big, nothing really, not a big trauma, but he lived with criticism because this was the way of his parent to show love, and to hone the child to. So how would you, I mean, practically, how would such a child go back to his past and heal this?
Well, you can simply ask the person to summon the parts of themselves currently that are caring and kind and loving and strong and courageous, and then mentally go back in time and visit their self when they were 8 years old or 12 years old or whatever, and they imagine meeting that person who's themselves, and they can feel what that person was feeling, what their younger self was feeling, the emotions that they were feeling, the hurt, the sadness, the anger, the depression, the fear. And they can empathize with that person, and then give that person in this imaginary scenario what they needed, which was love and caring and compassion, and give them the opportunity to express their feelings. And they can help them imagine doing whatever it is they need to do, so they can create a new experience for that person, that younger version of themselves, who's empowered, who cares for themselves, who can stand up for themselves. Maybe the person wants to talk back to their parents, or scream at their parents, or tie their parents up, or tape their mouth shut, or push them out of the house, or whatever it is that they need to imagine doing or maybe they need to, ask their parents to just love them, and hold them and hug them. And then yourself, your adult self is hugging that person and caring for that person and letting them cry and letting them scream and letting them do whatever they need to do. And then maybe you take them to a beach and you laugh and you give them space and you ask if they can let go of their hurts. And, it's a variety of of things that people have learned over the years to help heal the big trauma or the little traumas, as you pointed out, and then to help them let go and help them see that they are going to be okay. They're going to make it. And when you take away some of the hurt and guilt and anger from the child, then the adult who's in current life, in present times, can also feel relief and begin to realize that they're okay in the present, that they are safe now. They don't have to carry around all this hurt and mistrust as much. And they can practice, as I mentioned before, self-compassion now in the present. So they're healing their past and they're healing their present at the same time.
And in your research, have you actually checked the biological mechanism, how these techniques change something in the scars of the psyche and the scars in the DNA, and does it have an actual manifestation on our physiology and biology?
We've done, for example, we have one randomized controlled trial. We did two randomized controlled trials using this kind of emotional awareness and expression therapy that I mentioned. And we showed that this therapy was more effective than standard talk type of therapy, more effective than standard cognitive behavioral therapy for reducing physical pain in adults with fibromyalgia and with chronic musculoskeletal pain. We also have another randomized controlled trial with people with back pain. The first two that were done, one was done at UCLA in Los Angeles, one was done in Detroit and Ann Arbor here in Michigan. The other study, the one with back pain, was done at University of Colorado. And in that study, we also showed very high rates of resolution of chronic back pain. 75% of the people who were treated and 66% of the people who were randomized were virtually pain-free in 1 month after average duration of 10 years of back pain. And in that study, we had fMRI, functional MRI testing of the brain prior to and after the treatment. And this treatment was geared toward making them feel safe in their body, safe in their lives, particularly with feeling that, knowing and understanding that the pain wasn't dangerous, that it was a manifestation of their brain, and that they were going to be okay, and giving them exercises to help calm their brain. And we found significant changes in the brain imaging, showing that the brain had changed in terms of connections between the insula and the prefrontal cortex, and areas of the brain that are connected to safety and emotion. So we have that.
Amazing.
There's other studies that have shown effects on cortisol levels and other biological markers. Heart rate variability can change. There's a variety of other biological markers of feeling more safe or more unsafe.
How about biomarkers of inflammation like CRP and the segmentation rate, the ESR?
In the Colorado study, we did some interesting testing. I haven't seen the results yet of looking at inflammatory markers, but one of the things that we're not 100% sure about this, but it's my view that there's no question that stress and emotional trauma can cause changes in inflammatory markers, CRP and SID rates. And some people who have stress and trauma are more likely to develop autoimmune disorders.
That's right.
arthritis and lupus and Crohn's disease and ulcerative colitis. There's no question about that. But people with headache and back pain and irritable bowel syndrome and fibromyalgia, in my opinion, they may have high inflammatory markers, but it's not inflammation that's causing the pain.
What is causing the pain?
This kind of inflammation is micro-inflammation. It's not macro-inflammation. Macro-inflammation occurs in rheumatoid arthritis and lupus, and that can certainly cause pain, but the vast majority of people with chronic pain have headache, back pain, irritable bowel syndrome, chronic pelvic pain syndromes. Those people do not have macro-inflammation. They don't have inflammation that's obvious, that you can see, that's demonstrable on visual exam. They have micro-inflammation, but everyone has micro-inflammation. Everyone has inflammation in their arteries and a variety of in their gums and many places. And stress can cause that. But the pain and the symptoms are due to neural circuits in the brain that have been learned, that have been reinforced, that have been turned on, and that can be turned off. So you can lower pain by changing the brain without changing inflammation, because inflammation doesn't change within seconds. Pain can change within seconds.
Amazing.
When we do our work with people, their pain can turn on and off within seconds, within minutes. Inflammation changes over days or weeks. And so I feel strongly about this.
Good.
Because people are promoting that pain needs to be healed by changing inflammation. And that
because inflammation is connected to pain. It's
like I say, macro-inflammation can cause pain.
So when you say macro-inflammation, do you mean something systemic versus something local, or they are both?
Macro-inflammation is generally local. Like you have an abscess in your throat, in your tonsil. That's a local macro-inflammation. You have macro-inflammation in your joints. You have rheumatoid arthritis in your hand. There's inflammation. It's red. It's hot. It's swollen. Again, that's local. Systemic is everywhere, and systemic inflammation is micro-inflammation, and that is present in a lot of people to more or less degree. But for the vast majority of those people, it's not causing pain. It's just and it may go down with relief of stress. But you see, stress causes inflammation, and stress can cause neural circuits causing pain. But inflammation is not the cause of the pain. And so if you give people diets to lower inflammation, they have to change their diet. That's not going to change their back pain or their headache or their irritable bowel syndrome. It may change it by a placebo effect of making them feel more comfortable and more safe. But I frequently see people who are told they can't eat all these foods, and then they get more stressed.
Yeah.
The symptoms get worse because they're more afraid and they're more fearful of food, just like they're more afraid of so many things in their life. And that's counterproductive, in my opinion. So we need to really...
So all these diets, the AIP protocol, the autoimmune protocol, the anti-inflammatory diets, now they are talking about the Paleolithic diet as anti-inflammatory, or on the other side of the spectrum, the vegan and the raw foodists say that their doctrine is anti-inflammatory. And
I'm not saying those are bad. You may live longer, if you want to prevent diabetes and heart disease. Maybe you can prevent cancer. I have no idea. I don't know that that's been shown, but you may live longer with healthier diets. I have no problem with that idea. I'm not arguing that. What I'm arguing is that those diets are not going to cure your back pain or your headaches or your irritable bowel or your fibromyalgia. Those are not inflammatory conditions. And those conditions, are not improved by giving steroids. You can give corticosteroids. It's completely anti-inflammatory. Those conditions aren't improved by those things. So how's inflammation the cause? I don't think that's the case.
Because inflammation sometimes is characterized by swelling, and swelling can put pressure on the
Macroinflammation can. Macroinflammation can cause pain. I agree 100%. And if you have macroinflammation in autoimmune disorders, guess what? Give steroids, it will make the inflammation go away. It will help. But that's different.
But actually, Dr. Sarno, in his book, I recall there is a chapter, he's talking about autoimmune issues like ankylosing spondylitis, rheumatoid arthritis. He says that it is also a TMS issue.
Okay, so I don't disagree with that either. So there's a spectrum, a spectrum of illness. And some illness is, I would argue, purely mind-body illnesses, like headache, migraine, assuming you've ruled out any structural problem, right? Back pain, assuming you've ruled out a structural problem. Fibromyalgia, assuming you've ruled out a structural problem. Irritable bowel, pelvic pain syndromes. Those are clearly, and I see that's what we do every day. Those are clearly mind-body disorders. There's no pathology. There's no inflammation causing those. You just need to treat the mind. On the other extreme, I would argue that people with cancer have a lot of structural disorder. I mean, there's tissue damage, and how much of that you can heal with the mind. Maybe there's some of that, maybe all of it, I don't know, but there's clearly structural damage. And if I have cancer, I'm going to treat the cancer using medical treatment. I'm not against using mind-body treatment for cancer as well. There's nothing wrong with that. But and some people clearly have cured their cancer using mind therapies alone, but it's not as effective, in my view, as in this other category where we have very high rates of short-term resolution of symptoms using mind-body therapies. And then there's some that are in the middle. So autoimmune disorders would be in the middle. We know that the brain can affect the immune system. So if you have rheumatoid arthritis or lupus or Crohn's disease or ulcerative colitis, you can do both. And many people have had resolution of those disorders using simple mind-body therapies. And there is inflammation involved in those. And I would put those in a middle kind of category.
I see what you mean. I wanted to talk with you in this context about the bracing pattern that people who suffer of chronic pain or autoimmune disease, because sometimes there is an injury which creates structural changes and even deformities in the tissues or in the bones, but then the fear around it, the worry, the emotional burden around the injury perpetuates the pain, and so people who come to the TMS work, to the Dr. Sarno work, the constant question is it structural or psychological, more something of the mind, but can you say how to discern? Because as you say, it is not cut clear. Yeah.
The vast majority of people with chronic pain do not have a structural problem. We did a recent study, we haven't published it yet, where we evaluated very carefully over 200 people with chronic neck and back pain. And we found that 85% of them do not have a structural problem. They may have had injuries. Many people have had injuries. As human beings are designed to be injured and to heal. All injuries heal, and structural problems heal. You may end up with a limp if you have a severe structural problem. You may end up with a curvature of the spine. You may end up with a leg length discrepancy. There's a lot of structural disorders that can be severe and can lead to deformities, but our body adapts to those deformities. Our brain adapts to those deformities. And if pain is occurring after an injury, after the injury is healed, it's because the brain has taken over that pain. The brain has learned that pain because the injury has healed.
That's
And
right.
Scars do not hurt. Sometimes we heal with scarring. Scars are not painful. There's this idea that someone has a car accident or a mild injury and then they have pain because of that injury. No, that's not the case. I was just talking to a friend of mine who spent some time in West Africa, working in a rural area, and he saw people with tremendous injuries, head injuries that we would call concussions and traumatic brain injuries, and people with all variety of cuts and scrapes and broken bones. And he did not see chronic pain in that population. There was no chronic pain. There was no chronic head injury. There was no lasting concussion injury. There was no whiplash injuries that lasted for months or years.
So even what you're saying, that even if take the discrepancy between the legs or a degenerative osteoarthritis, bone-on-bone issues, they do not necessarily have to be painful?
Everyone gets wear and tear of their bodies over time. Everyone gets some degree of osteoarthritis over time. And if you look at x-rays of people's joints as they age, they get more and more osteoarthritis. But not all of that is going to be painful. And so if you look at the correlation between people's pain and people's x-rays, there's no good correlation, very poor correlation between x-ray evidence of osteoarthritis and pain. Now, clearly, some people have severe levels of osteoarthritis in a hip or a knee, and some of them will need a joint replacement. That's fine. That is true. But it is over in our modern medical world. We're over-diagnosing. We're confusing pain. We're assuming that all pain is due to a structural problem. And when we see evidence of arthritis on an X-ray or an MRI, we're assuming that's the cause of the pain because we're not being careful to discern or diagnose the pain as being structural or non-structural. And so you're asking, how do we make that determination? And the answer is that almost all the time it's relatively easy to do. And that's what we did in that back pain study that I was talking to you about. And we've published and I've written a whole variety of criteria that one can use to determine if pain is due to the brain, neural circuits in the brain, or due to structural problems, or due to a combination of the two. And so if once you've ruled out a severe structural problem, no infection, no cancer, no tumor, no autoimmune inflammatory condition, etc., once you've ruled those out, and you just have, say, arthritis on an X-ray, whether it's mild, moderate, or severe, then you ask the person, well, where's the pain? Is the pain in this part of the knee or that part of the knee? Sometimes it's in this side, sometimes it's in that side. When does the pain occur? Does it occur with walking? Well, sometimes it occurs with walking, but sometimes the pain goes away while I'm still walking.
That's right.
Sometimes the pain goes away when I'm on vacation. Sometimes the pain occurs when I have more stress. Sometimes the pain occurs when the weather changes. So there's a variety of factors. If we pay attention and we listen to the story as opposed to just assuming that all pain is due to a structural problem, we can discern. And if the pain shifts and moves and turns on and off and is triggered by innocuous stimuli, that is telling us that it's the brain causing that pain.
Yeah.
And then we can work with that patient and help the patient make the pain turn off. by using simple techniques that we've written about,
Yeah.
such as pain reprocessing therapy that we
Yeah, by Alan Gordon. Yeah.
study, and emotional awareness studies. When the pain turns off, when you do an emotional technique or you do a pain reprocessing technique, then you have confirmatory evidence that the pain or the symptom is due to neural circuits in the brain.
I wanted to ask you a really big question, but last one about this. You were talking about arthritis and bone issues, skeletal issues. What about soft tissues when they are inflamed, like chronic tendonitis or tendinosis or Dupuytren issues with the hand or Lederhose in the these kind of fascia issues. In a way, they are related to fibromyalgia, but it seems like it is more tricky when it comes to the soft tissue.
Soft tissues are the same as any other tissue. If you have a fracture of your bone, it's going to take roughly 6 weeks for most fractures to heal. So somehow some people in the medical profession have the idea that soft tissues don't heal. That doesn't make any sense to me. All tissues heal. So if you have tendonitis and you rest it, it'll get better, it'll heal.
But what if it is already been scarred?
Scars don't hurt.
They don't hurt, but the function is undermined. The function of the tendon is.
That's what I was saying before. We adapt to variations. Yeah, people can have injuries that cause limbs. People can have injuries that cause their hands to be deformed. Pain is a function of the brain. Okay, all pain is caused by the brain.
Yeah.
And pain can occur due to tissue damage, but after healing occurs, there's no tissue damage, and the brain will adapt to those changes if there's functional changes.
So why are there people who are stuck? Why does the pain lingering in some people and it becomes a chronic pathway, as you say, in the brain? And how do you actually access this pathway if it is so hidden? So it's not tangible.
It's not that hard. First of all, why does pain linger? Pain lingers because people think they're injured.
Oh.
Pain lingers because they think there's ongoing damage. Pain lingers because there's fear of the injury, because people have told them, because the medical profession tells them you have CRPS or you have RSI or you have these disorders, fibromyalgia, etc. You look them up and you read they're incurable.
That's right.
So pain lingers because of fear of pain and the conceptualization of it as being incurable and that you have ongoing damage. That is a big cause of lingering and persistent and chronic pain. On top of that, pain lingers because of fear of the pain itself, because of focus on the pain, because of frustration with the pain, because of trying to heal it and using all these different techniques, including injections and diets and surgery and massage and acupuncture and physical therapy. And when none of it works, you get more and more frustrated, and all that fuels the danger and alarm signal in the brain. And the third reason why pain tends to persist and linger is because of emotional trauma and upset and childhood trauma that we talked about, and stress in people's lives. So if they have an ongoing situation with their work or their child or their spouse or their neighbor, or the political situation in the country or the virus situation in the world, all those things can fuel this danger alarm mechanism and make pain linger. So those are 4 main reasons why pain will persist in some folks.
So let's talk about safety. about how to cultivate a sense of safety. And let's take a person who, as I said before, is living in an emergency state of mind without even knowing it. Like it is so transparent to him because this is the way he was brought up. His parents were warriors, and the whole environment was stressful. Suppose he grew up in a crime neighborhood, and he was very vigilant from young age, and his brain learned to be vigilant and alert all the time. And he feels actually when his inner self-talk is that the world is a hostile place, and the next shoe can fall any moment. So how would you approach such a person who is so immersed in the fight, flight, freeze, in the sympathetic, and he's kind of hooked in this emergency state of being? How would you access his brain and train it and reprogram his brain to feel safe again?
Well, you start with compassion. You start with compassion and caring and love for that person. You start with understanding. You start with listening to them and allowing them to talk and tell their story. And you listen to that story, and you help them see the issues that have occurred and are occurring in their life. And you help them to begin to be compassionate to themselves. And as you do that, you can then help them understand what the story means and change the story. Help them change their narrative from one of fear and mistrust to understanding and caring, and help them see that, of course, their brain is going to be afraid. Of course, they're going to not be trusting. Of course, they're going to be living in fight or flight because of what happened to them. And then help them see that their current diagnoses are not dangerous, if that's the case. If they don't have clear structural problems, then you can help reassure them currently that their body is not damaged. And then you give them techniques and help them to reduce the fear of the pain or of their symptoms. And then you help them to see what they can do in their lives to help them be connected and safer and happier now in their lives. And you can then, as I mentioned earlier, work with memory reconsolidation and emotional techniques to deal with the trauma and the traumatic experiences that they had in their lives. And gradually, over time, you can help them to heal emotionally. And they don't have to heal physically if they're not actually damaged, but they have to reconceptualize their story as one which makes sense, and to help empower them that they can do something about it. And it all starts with listening. It all starts with understanding. It all starts with compassion.
Compassion is a very overused word in our new age times, but actually, how do you do it when you have no access to it? When a person is so vigilant and so fearful, and many times he's self-berating himself because of his
you demonstrate compassion for them.
Mm-hmm.
And then you help them to see. Most people who have difficulty with self-compassion are able to be compassionate to others.
That's right.
So you can help them to access the compassion they have toward others. And then you can help them to learn to transfer and use that compassion they have toward others toward themselves, and particularly toward the person they were when they were younger. So when they can go back in time, how do they see that younger version of themselves? If they had if they had a child who was being treated the way that they were treated when they were a child, they wouldn't accept that. They wouldn't be happy about that. They would intervene and make changes to protect their own child who was being treated as they were treated when they were a child. And so there you have an entree into them developing compassion for themselves.
Because you are also an MD, I want to ask you about the bracing pattern of the body. And I believe Dr. Sarno called it, he mentioned a mild oxygen deprivation from the tissues. There are people who are bracing their bodies without, of course, it is also transparent, it is unconscious. They live like this with in a clenched mode, and it is not necessarily the muscles. Sometimes it is the blood vessels are constricting and creating symptoms like Raynaud disease, or sometimes it might be, as I said, the tendons or the fascia. The fascia is constricting. Can you, what's your take on the bracing pattern of the body? And many people, they can feel the contrast, because if they have a graceful moment when they feel part of their body is expanding and feeling at peace, they see the contrast between the other parts of the body, and then they can notice that they are living in bracing, in tightening themselves. Can you also access this mechanism of?
Well, first of all, the bracing and the constriction is caused by the brain. So our brain creates what we experience, and the muscle tension and the bracing that people have, and the vasoconstriction of the arteries with Raynaud's, those are all under control of the brain. The autonomic nervous system of the brain, and all the neural circuitry of the brain. Our body, now, how to access that? You can intervene in what we call top down and bottom up. So you can intervene using physical techniques, and that's there's a lot of people working in somatic therapies, and a lot of great physical therapists or physiotherapists, and body workers and acupuncturists and massage therapists. All can work to help calm the body as a way of calming the brain. What I think is important to understand is those bottom-up techniques should not be designed to fix the body or change the body, because the body is not broken. The changes in the body are reversible. They're under control of the brain.
I see the distinction. So you mean when you do these bottom to up modalities, remind yourself that you're doing this for training the brain.
Correct. That is critical, because it can be frustrating and annoying because people have. I saw a woman who had very severe big muscle knots in her back, and the muscle was very tense and all knotted up, and she kept having these dozens of treatments to fix the muscles, with needling and massage and cupping and all sorts of things, but the muscles they would relax temporarily, then they get tight again, they would relax and get tight again. We have to treat the brain, and so doing this by saying this is treating your brain, there's nothing wrong with the muscles. We're teaching your muscles to relax so we can train your brain to relax the muscles. So everything really comes down to the brain, and I think, if body workers can understand that, I had a patient with severe eczema, severe skin rash. She had it since she was really an infant. And, everyone had told her it was allergic and it was, not under control of the brain, that there was something wrong with her body. And she had a big eczema outbreak when she came to see me as an adult a few years ago. And she told me that a few years earlier, she had a very severe bout of eczema all over her body, and she got a few acupuncture treatments, and it completely disappeared. And I
Nice.
said, oh, it is under control of your brain, because acupuncture is changing the brain. It's a brain treatment, even though it's based in the body.
Nice.
And that one little fact, that one historical fact, gave me the confidence and understanding to tell her that this is under control of the brain. And that gave her the understanding and the confidence. And she went out and just changed her brain. She just relaxed about the eczema, and she told herself she was fine and calmed her brain, and the eczema disappeared in a week.
Wow. So this was top down.
Top down, right? The acupuncture was bottom up, but it's still actually top down.
Yeah. So let's take Raynaud disease, the constriction of the blood vessels in the extremities. There are people, and you know what I noticed, that people with autoimmune issues, they have a tendency to cold hands and feet.
Yes.
And many times to low blood pressure as well. Can you say if in your opinion, Raynaud and poor circulation to the extremities, is it a TMS issue? Is it as you see it?
Raynaud's phenomenon is not poor circulation. Poor circulation, can be a medical problem if there's blockage of the arteries. Raynaud's is not blockage of the arteries.
That's right.
It turns on and off, right? It turns on and off because it's under control of the autonomic nervous system of the brain.
So do you believe this also can be treated with
of course
the up-down?
Of course.
Yeah.
Because you're seeing this on and off phenomenon, this turning on and off phenomenon within seconds, within minutes.
So how would you access the blood vessels? By visualization, or just by
just calm the brain.
Calm the brain.
Yeah, you calm the brain. How do you calm the brain? You breathe, you calm yourself, you tell yourself you're okay. You look at your finger and say, oh, it's all red and funny, or it's all white, and it has a funny sensation, and you just smile at it. And you just allow the sensations to be there without reacting, without fearing them, without freaking out.
So now you're talking about acceptance and embracing
yes,
any sensation that comes. How acceptance is so connected to healing?
Because you're calming the danger signal in your brain. You're accepting that you're okay, that the sensations are not dangerous. You're not reacting to them with fear or frustration. You're not trying to fix them because you're not actually broken. All of these things are calming the threat detection system, the danger system in the brain. And when the brain feels safer, it will relax, and it'll relax the body. It'll relax the muscles. It'll relax the blood vessels. It'll go back to this resting and healing state. And the body knows how to do it. The brain knows how to do that, and the brain knows how to turn the body back to that resting state. Now, in some people, they have, as you pointed out, they're been living in fight or flight for so long all the time that they don't come back to quite as low level as somebody who's, very calm and composed,
Yeah.
But, everybody has their ability to modulate this up and down, more tense, less tense, more danger versus more safety. And over time, we can train ourselves, we can train our brain to live more in safety, because the brain is neuroplastic. This is true. This is true at all ages. You can be 105 years old. Your brain is still neuroplastic.
Dr. Schubiner, if you had to instill some main insights from your experience, personal and professional, what would you say to a person who suffers of a chronic condition and they feel depressed, he feel he is doomed, he feel it is incurable, and he even loses his will to live. He doesn't, even if he is not suicidal, he doesn't care if he will die. Because these long conditions can, they actually strengthen the vicious cycle of the...
Correct, yeah. You know, there's certainly tremendous amount of suffering in the world, tremendous amount of abuse, tremendous amount of poverty, tremendous amount of injustice, tremendous amount of racism, discrimination against people for, you know, for who they love and who they are, and you know, where they grew up and what color their skin is. There's tremendous pain and suffering in the world. And I would argue that there's also always some degree of choice. There's always some degree of choice that people have. And of course, Viktor Frankl wrote about that and lived that in his life. And everyone should read Viktor Frankl and his story because there is always some degree of choice. And you have a choice whether to live or die. You know, existential question.
Yeah.
Will I live? Should I live? Should I kill myself?
Why do we bother? Why are we... People come with the, you know, when they hear the verdict that their condition is incurable, they say to themselves, why do we bother? Why should we? I mean, these existential questions float immediately.
There's always some degree of choice. You know, no matter what your external circumstances are, and admittedly, many external circumstances are extremely difficult. And yet, Viktor Frankl argued there's always some choice of how you think, what you believe. And you can choose in some level, at some levels, if you decide to live, if you choose life, if you choose not to die, that's choice number one. And then the next choice is, if you're going to live, how are you going to live, given your circumstances? Many circumstances are not changeable, but we can choose to change our attitude. We can choose to change our mood. We can choose to change how we think about our circumstances. And we can choose to find meaning and purpose in our lives. And we can choose, hopefully, to find social connections. And we can choose compassion. So if we choose compassion, if we choose meaning and purpose, whatever that is, maybe the meaning and purpose is simply to get up and go outside and look at the sky. Maybe the meaning and purpose is to do something, to smile at somebody else, to give them a smile. Maybe the meaning and purpose is to connect. And so there's always room for hope, in my view. And hopefully we can help people see that with many of these conditions that were formerly thought to be incurable, that there is hope for those conditions. And when people begin to have hope, that can make a huge difference in their life.
Wow. Yeah, it is a very optimistic and good news that I keep thinking, like the word, that even the terminology of autoimmune, which is coming from within, it is auto. So maybe the other way around is also possible, that you can also claim your autonomy to heal yourself, and many people have.
Right. And
Is there a book that you recommend for people? I know that you have a very good book, Unlearn Your Pain.
that's the name. I've written 3 books.
Oh,
Yes, one of them is Unlearn Your Pain. One of them is Unlearn Your Anxiety and Depression. One of them I wrote with Dr. Alan Abbas is called Hidden from View, which is for professionals on how to do this work. There's also a textbook for professionals on psychophysiologic disorders that's available from the Psychophysiologic Disorders Association. There's resources at the tmswiki.org as well.
yeah,
So those 2 websites, the tmswiki.org and the ppdassociation.org, are nonprofit sites with clearinghouses of information for people. And they have all the books that have been written and podcasts that have been done and research articles that have been published. And this is an understanding. This is a paradigm shift in how we see health and illness to a significant degree, and particularly how we see the mind-body connection. It's relatively unknown in most traditional medical circles.
yeah,
And it's even unknown, I would argue, in many alternative medicine circles where
that's right.
attention is given to the body, to the exclusion of the brain.
That's right.
If you want to understand predictive coding, which is how the brain creates what we experience, I recommend the book How Emotions Are Made by Lisa Barrett.
Lisa, what's her name?
Lisa Feldman Barrett wrote How Emotions Are Made, and it talks about how our brain creates what we experience, the concept of predictive coding. And everyone should understand that as well.
What is your relationship with pain now versus I believe you are muted. What is your relationship with pain? How do you see pain now from all your research, and you had pain? What has changed?
All pain is generated by the brain, either in response to physical injury or emotional injury. Pain can be turned on and off by the brain. Not all injuries cause pain, and not all pain is due to injuries. We can determine what the cause of the pain is by the mechanisms that I mentioned, the evaluation, assessment tools that I mentioned. And pain is a warning signal. We need pain in our lives. If you don't have pain, you will die. If you don't have a danger signal, you will die. You will walk in front of traffic. If you don't have pain, you will hurt yourself and not know it. And so pain is a gift. Pain is a gift that our brains have. Some people believe pain is a gift from God because God created us and therefore God created pain. It's a gift that we have. Other people believe we evolved to have this gift of pain, but it is a gift.
But
And,
most people resist it and oppose it and reject it.
well, it's a message, and it's up to us to understand what the message is. If you break a leg, you want pain because it's a gift so that you can get treatment to stop walking on a broken leg. And if it's pain due to an emotional issue, it's a gift so that you can address the emotional issue. So either way, it's necessary.
You know, after talking to you all this time, it seems to me surreal that people even go and flock on hospitals and waiting queues to get their injections and to pump themselves with anti-inflammatories when the solution is here. It is within, and but maybe it's a harder walk. I don't know.
Well, the alarm signal is very powerful. When a smoke alarm goes off, it's very loud. It's very loud, so it gets our attention. When the brain creates pain, it's often very loud, very severe, and it feels like we're dying. It feels so severe that people will do anything. They'll be desperate to get out of pain. So of course, people are going to do anything that they can to get out of pain. That's a natural human response. It's just that in addition to that, we need to begin to look at the root cause of the pain and begin to help people understand whether the answer lies in medical treatment or it lies in changing the neural circuits of the brain. And that's what our job is. That's what our work is, so that people have an open mind to look, to investigate. When someone has pain, it's a warning signal. It's an alarm. There's something wrong. And it's up to us to help people figure out what is actually going wrong.
So is it fair to say that according to the thing that you said before, that pain and unease and dis-ease and discomfort in the body are created by lack of compassion, lack of sense of safety, and lack of and disconnection from other people, from social connections?
Yes, when it's not caused by a physical disease. Like you can have a lot of disease in your unease and tension in your body if your thyroid gland is very high, hyperthyroidism.
Mm-hmm.
Or you have a arrhythmia of the heart that's causing severe tachycardia. You're going to feel very diseased. So you have to.
So if we are so powerful and we can affect the body with the power of this box between the ears, how come that we die? Why can't we control the decomposing of our bodies, the natural decomposing, and the entropy?
You'll have to ask someone way smarter than me to answer that question.
Yeah, but anyway, the message that you conveyed is I think it is a very good news, very, very happy news to people in suffering.
Yes, I think so. There's always choice, and we can look closely to determine because the vast majority of people with chronic pain do not have a structural problem. I believe that is a medical fact, and we've shown it, and I believe we've proved it, and I think it's very clear. And so there is hope for the majority of people who are suffering with chronic pain and many other conditions that are what we would call functional, where there's no clear structural disorder.
And many times, even if it is structural, they can have a deformity and not feel the pain. It is also possible. They should not rule it out.
Correct.
So Dr. Schubiner, I'm really very, very grateful to you for your time and patience and wisdom and sharing these ideas with fellow sufferers around the world, because we all suffer as you mentioned before. It's part of the human condition. So thank you very much. It was it even was better than my expectations. So thank you so much.
That's very kind. Thank you very much, Anna.
Bye-bye.
Bye-bye.